Australia's in the grip of a whooping cough outbreak that's already killed a newborn baby in Melbourne this week. 1,300 infections have been detected in Victoria since January, double the figure from the same time last year. That sparked fresh calls for adults and children alike to be vaccinated. Dr. Jenny Royle is from the Royal Children's Hospital in Melbourne.
Yes, since 2008 we've seen a great increase in whooping cough all around Australia, and we've now got a sustained epidemic throughout the country.
This is the first death in Victoria since 2004. Why is it that infection rates are increasing?
What we've got at the moment is that the whooping cough germ has got into the susceptible adult population. When adults and adolescents are exposed to whooping cough, they can catch it and pass it on to babies. The difficulty is that the vaccine we use in infancy works very well after you've had your 3 baby doses, but it doesn't provide lifelong protection. So really the whole adult population could catch whooping cough, and we need to really think about this, and particularly new parents having a baby, they can actually go and get a whooping cough booster. If we gave vaccine to the adults that are in contact with babies under 6 months of age, then we could really help protect those babies who haven't had a chance to have their 3 vaccine doses and be really nicely protected yet.
Whooping cough symptoms can be quite innocuous, not unlike the common cold in adults. So is it the case that this is being spread by people who don't know they have the illness?
Whooping cough is very difficult to diagnose. It starts like a common respiratory infection with a runny nose and a cough, and then it progresses into an illness which is more easy to identify as whooping cough. But you're infectious with whooping cough for about 2 to 3 weeks. If you picked it up earlier and some whooping cough antibiotic was given, then you could actually reduce the time that you're infectious for. So if people think about that they might have whooping cough and go to the doctor, then they could actually get some treatment to help make them less infectious and less catchy to babies, and that would be really important at the moment.
And briefly, Doctor, what's your message to parents who might be concerned about the safety of the vaccine?
I think at the moment there's never been a more important time to immunise your baby. Immunise on time, don't prolong the window period where they could catch something. And if families have got individual questions or worries about vaccine, all questions are valid, go and talk about them with your doctor, because the risks and benefits are important to weigh up, and at the moment the benefit is absolutely compelling, and we really have to help every family be fully informed about how to prevent this terrible disease.
Dr. Jenny Royle from the Royal Children's Hospital in Melbourne, thank you.
Pleasure.